This presentation aims to provide guidance on how to properly secure a gastrostomy tube, which is also known as a G-tube, in order to ensure safety and prevent complications. A G-tube, or gastrostomy tube, is a medical device that is surgically implanted into a person's stomach in order to provide direct access for delivering nutrition, hydration, and medications. It is commonly used with individuals who have difficulty swallowing. The G-tube must be properly secured to keep the feeding tube in place and prevent serious problems. Following best practices for securing the G-tube will ensure that the individual is safe and gets the best possible results. If your G-tube is secure, it won't get pulled out or displaced. That's important because it can lead to complications like skin irritation and infection. Keeping the G-tube in place also helps keep bacteria and other things from getting in, which lowers the risk of infection. A well-secured G-tube will ensure that there is a tight seal to prevent stomach contents from leaking out. This reduces the risk of skin irritation. These are the steps for carrying and securing the G-tube. Wipe the skin around the G-tube with a clean, damp cloth. Use a gentle touch to get rid of any dry drainage or crusting. Be careful not to pull or tug on the tube. Then secure the G-tube in place using a securement device, such as a tube holder, abdominal binder, or tape. Ensure the tube is not pulled or twisted and that the securement device is not too tight. Before using the G-tube, make sure it hasn't moved or become dislodged. Also check that the tube is still in the right spot. Flushing the tube with water before using it helps determine its functionality. Additionally, check the markings on the tube to make sure it's in the right place. Lastly, when moving or transferring, always be aware of their feeding tube. If it gets caught on something, it can be a real pain. To prevent this, you can temporarily tape the tube to keep it out of the way. There are different types of securement devices. The most common is an adhesive pad or simple 4x4, which can cover feeding tubes and other medical devices. They act as an anchor point. At our facility, we use 4x4s to secure feeding tubes for all of our individuals. Abdominal binders are another common way to secure feeding tubes to a person's body. These two are used widely by us. There are other specially made devices to secure G-tubes. However, many of them require adhesives that stay on a bit longer. Because of that, we don't always use these type of devices because it can irritate the skin. But we will look into it for future use. Proper cleaning and care is super important with G-tubes. Wash your hands thoroughly with soap and warm water before and after you clean the skin around the G-tube. This will prevent the spread of germs and reduce the risk of infection. Check the skin around the G-tube for redness, swelling, or irritation. This can help you spot potential problems and deal with them right away. When cleaning the skin around the G-tube, be gentle. Use a clean, damp washcloth. Avoid excessive force or rubbing. Afterward, dry the skin gently with a clean, soft towel. Make sure the area is totally dry to prevent moisture buildup. Moisture buildup can cause skin irritation or infection. As always, notify the RN consultant or medical provider if any issues are seen. When using adhesive dressings or 4x4s, keep in mind the following. Take the 4x4 gauze and pass the G-tube through the opening in the middle of the 4x4. Make sure that the gauze is completely surrounding the tube. This will help keep the G-tube in place and catch any drainage. If your 4x4 gauze does not have a hole or cut, you can make one yourself with a pair of sharp scissors. Tape all 4 sides of the 4x4 with paper tape to secure the G-tube. Fold or coil the G-tube and tape it to their stomach or the existing 4x4 if they have sensitive skin. Make sure the tube has some slack so that it doesn't pull on the site. Apply the abdominal binder, which we will discuss in the next slide. And once again, notify the RN consultant or medical provider if any issues are seen. Abdominal binders will be the last thing you will apply. First, while the individual is on their back, place the abdominal binder beneath them at their lower back with both ends hanging loose on each side of the person. When using an abdominal binder to hold in a G-tube, put the binder on so the stoma site is in the middle of the width of the binder. Then, coil the G-tube so it's in a spot where the binder will cover it. Wrap the abdominal binder around the abdomen, under their clothes, with the closures in front. Make sure the binder is snug but not too tight and that they can breathe easy. If the abdominal binder gets wet or dirty, it can irritate your skin and up your risk of infection. To keep it clean, spot clean it and let it air dry. And not to sound like a broken record. Notify the RN consultant or medical provider if any issues are seen. Thank you for listening. We will now open it up for questions and demonstrations.